This lesson is about letters in the Arabic alphabet that need to be differentiated. Objectives. We will look at some Arabic alphabet letters that sound very similar, and we will check that we can distinguish the sounds that are similar. So the object of this lesson or small practice is just to make sure that you understand the difference between some certain alphabet letters that sound very alike. Now, as we've done before, we're going to use the Sukun version of the letters preceded by a Hamza with a Fatha giving the ah sound, and we talked about this in the detailed lesson on the Makharij, that this is a known technique of just checking where the sounds are articulated from. In this case, we're doing it really just to check you can make a slight different sound between the letters. The first one then is the Hamza, and as we explained before in the previous few lessons, when you have Hamza with a Sukun on top of it, the sound preceding it, in this case the ah sound, is going to be cut short because the Hamza is the glottal stop. So normally this Hamza on top of the Alif with the Fatha would be ah. With a Hamza after it with a Sukun, it will become ah. So it's almost half the sound. So ah, ah. The next one is the soft ha, which comes from the bottom of the throat. So both the Hamza and the soft ha originate from the same place. Now with the Sukun and the ah sound before, it gives the sound of ah, ah, ah. So trying to bring the sound right from the bottom of the throat without pushing the air through the front of the mouth. So we have the Hamza version is ah, and the ha version is ah. Now the next one, the forceful ha, where you push the air from the middle of the throat out of the front of the mouth, it will take the sound of ah, ah. So it's more of the air coming from the top and front of the mouth than the previous ha. So the two has then, the first one, the soft one, will be ah, ah, and the second one is ah, ah. So again, those first three are very much alike. And then we have the ayn, and again you could pretend that you're at the doctor's and say ah, and then block the throat. So it's ah, ah, ah. So going across the entire line though, then those four letters. So the first two are from the bottom of the throat, the second two from the middle. So it'll be ah, 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 and ah. So very slight difference. We'll do those again. Ah, 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 ah. The next line is the kaf, the kha, and the qaf. So again, these need to be differentiated. The first one, the kaf, is very soft, so it will simply be ak, ak. The kha, again, is tafkhim, so this will be akh, akh. And the third one is the qaf, which with sukun, i.e. when it's sakin, is qalqala, i.e. it's echo, aqqa, aqqa. So go through those three again, ak, akh, and aqqa, ak, akh, aqqa. The second set then, we have the ta and the ta. So effectively this is a tarqiq versus tafkhim version of the ta sound. The first one then is simply at, and you have to let a little bit of air through your teeth, at. And the ta is both tafkhim and it's qalqala, i.e. it's got a slight echo, which will be at, at. So we have to differentiate between at, which is just normal, and at. Now the third one is one of the ones that people really get confused with. We have the tha, the dhal, and the dha. So the dha and the dha effectively are a taraqiq and tafkhim pair, i.e. the dha is a heavier version of the dha. So we'll start with the first one. We have the tha, so this will sound as ath, ath. It's just normal soft ath. Then the dhal will be adh, adh. And the dha will be adh, adh. So that's tafkhim. It's heavy, lifting the back of the tongue up, a bit more full mouth. So all three of them will be ath, adh, adh, ath, adh, adh. Set 3. We have sin, za or zay, and sad, sad. So with the sin it will be as, with the za it will be as, and with the sad it will be as. So the sad is effectively the heavy full mouth version of the sin. So if we compare the sin to the sad, it will be as and as. So all three of them, as, as. And the bottom set here is the dal and the dad. So again, this is a taraqiq and tafkhim pair. So we have the lighter version of the D, which is dal, and the heavier version, which is the dad. So with the sakin version of those, we have ad, and that is going to be qalqala. It's one of the qalqala letters, so it'll be ad. Okay, so you've got to put a bit of an echo in there. Ad, ad, ad. And then we have the dad, which is not qalqala, but it is tafkhim. So it's ad, 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 ad. So we have ad, 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 and ad, ad. Okay, so conclusion then, we have learnt to differentiate the sounds that are almost the same. The most important thing from that exercise is for you to appreciate that you have to be very, very careful with the pronunciations, and you have to understand there's a difference between those letters. And we've only done it with them in their sakin mode, but with all the normal haraka, i.e. the fatha, kasra, dhamma, or with the tanween, you have to apply the same sort of preciseness and be very careful with your pronunciation, and do not mix up the sounds.